The information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Welcome to But Seriously, a physician and a patient talk crap. And let's get an intro from our physician, Dr. Soyka.
Hi, everyone. Thank you for tuning in to listen. I'm Dr. Caroline Soyka. I'm a gastroenterologist practicing for over the last 10 years. I see patients all shapes and sizes, men, women. I see everything from, I like to say that gastroenterology is a specialty from the mouth to the anus. So anything along that path is mine, with a couple other organs in between. I have a special interest and specialty in treating inflammatory bowel disease, which is Crohn's and ulcerative colitis. But like I said, I treat sort of everything from A to A. The other thing I'm really passionate about is women in gastroenterology and women in the field of medicine and the care for women in general in the field of gastroenterology. So hashtag women. And that's sort of how I found Sonia. We were both speakers at a conference called Scrubs and Heels, which is geared toward female gastroenterologists. And Sonia was speaking and I was speaking, and it was love at first sight.
It was.
So, Sonia, I'm going to pass the mic to you. Tell me a little about yourself.
Thanks. Hi, I'm Sonia Narang. I'm an executive coach and a change management geek, which means I help people and organizations change. And in 2013, I was diagnosed with ulcerative colitis. I think I'm on my seventh or eighth drug. I can't keep track. I am, by the grace of God, in remission after 80 infusions. Remicade is a great drug, but being lassoed to a IV for that long can get a little tiring. So I am a speaker at Scrubs and Heels, as Dr. Soyka said. I am passionate about the patient experience and how shitty it can feel, no pun intended, how elating it can feel when you get good labs, and the partnership we have with our practitioners, from the doctors to the nurses. I'm just so grateful for the different people in my life who helped tow me out of some really bad moments. So I really want to make sure patients, practitioners, physicians, nurses, everybody can hear both of our experiences. I love what you said, Dr. Soika, from mouth to anus. That is right on. Dr. Soika made us dance to Beyonce when she did her talk at Scrubs and Heels, and I was like, "Hello, Queen!" Like immediately, it was like it was a girl crush immediately. And I've also, my mentor, Dr. Ladding, says, after sex, like this is a very intimate topic. Like no one wants to talk about their gut or what happens in your poop and gas, except my IBD buddies and my physicians. So I think I'm excited about us like removing the stigma about talking literally about
Yeah,
your
it's funny
crap.
that you say that, because I have been saying this for the last 10 years. Colon cancer is so crazy right now. It's on the rise. We're realizing just the insane amount of unfortunate growth we have seen in colon cancer. And the numbers are something like 1 in 25, which is insane. It's the number one cause of cancer death in people under the age of 50. And I've been saying for literally the last probably decade and a half of my life, we need to figure out how to destigmatize
Yeah.
the butt. Like, how did we do it for the boobs? People were like, the boobs, with breast cancer, like, we're totally boob forward in this country now. We're like, wear pink, boobs rock, let's go. We totally destigmatized it. But I've said so many times, like, how do we do the same for the colon? And I don't know, maybe we're sort of on the cusp just because we have to be right
Yeah.
now. Because I do feel like with all this stuff in the news, like the most recent thing was James Van Der Beek, right?
Mm.
And so I think it's hitting
Wait,
home
did
for
he
a
die
lot
of
of people.
colon cancer?
He did.
Okay.
Yeah, unfortunately he did. As many people do, which is so sucky. But um, it's funny that you say that, like, we're trying, it's an awkward thing to talk about because I say this all the time, like, we need to make it not awkward. How do we make it not awkward? Just keep talking about it. We just keep talking about it. So I hope that by doing this podcast and you and I just talking crap, people realize it's not that big of a deal,
Yeah.
and everybody, like, what is that book for toddlers? Everybody poops, right?
Oh
Everybody
yeah, I
poops.
have this shirt. I'll wear it for our next one. I love it.
Everybody poops.
Yeah, I wear it to my like colonoscopies. And I'm like, look, sometimes when I get a colonoscopy, like I want to write on my, what side do we lie on? The left side? Yeah.
Hmm.
I want to write, hi, Dr. Bantala on my right hip or something.
You
Or,
should. People do the weirdest things. They're all so funny, though. I say, like, we're butt doctors. We have, like, a very weird sense of humor. Like, one time a patient left a little, I guess, like a note card, you would call it, like, in their butt crack. And when I went to do their colonoscopy, it, like, fell out. And it said, like, good luck or something. I was like, oh my God,
yeah.
people are really funny.
I wear crazy socks, but they don't see that. But I was thinking of doing like one of those like tattoos so I could make my care team shout out to UCLA Cedars, Dr. Bantala for and dude, that propofol is the best shit on the
Yeah.
planet, man. That
Or
stuff is
you could do an arrow insert here.
insert here. I know we have a very dark sense of humor, and I think it's how we cope and we make fun of it. Like that's the only way to destigmatize it is make it an everyday dialogue. Like we should be having conversations about your bowel movement, what it looked like, and that's what we're going to accomplish on this chat today. So roll up with your favorite cocktail, mocktail, caffeinated beverage, non-caffeinated beverage, and
Not to promote anything, but I'm still
I,
finishing my venti flat white, so.
okay, I'm being a very good patient right now and just drinking a lot of electrolyte waters. All right, let's get started. I am fascinated by poop and the anatomy of poop. I like that title, the anatomy of poop, because my registered dietitian at UCLA will be like, "How's your bowel movement?" And I'm like, "I delivered submarines today," and she cracked up because I
That's
gotta
funny.
have
Someone
fun.
today described theirs as torpedoes to me.
Yeah, yeah. I think everyone should be looking down in the toilet and seeing what they produce because it gives us a lot of data. So, like some of the questions I have, Dr. Soyka, are like, how many times a day? And what's your poop supposed to look like? And I know you have a sexy chart that you're going to share with us during this chat. So help me to understand how many times a day?
Well, I mean, I think that that's variable. I tell people there really is no normal. Like, you do not have to be pooping once a day, every morning, perfect shape. That's just not the case.
Mm,
And you don't have to be anxious about that, right? Everybody's normal is different. And I usually say, like, the three rule, you know, pooping up to 3 times a day or every 3 days, somewhere in that range is probably normal. And there is always going to be variation in what your stool looks like because we do not eat the same things every day. We do not drink the same amount of water every day. We do not get the same amount of exercise every day. We're not always feeling the same. We sometimes take our vitamins. We sometimes take new medications. Sometimes we're sick. All of these things affect us and our fecal microbiome and our GI tract. And they all contribute. And so to expect one normal bowel movement every day at the same time, I think is having false expectations. Now, that being said, what we look for as physicians is one, when you're moving your bowels,
Mm,
is it are you are you feeling like you empty out completely, right? Like when you
mm,
move your bowels, are you still feeling like you're just putting out little tiny rocks and you haven't made a bowel movement? Because that doesn't count. Or are you pouring out water
yeah.
and, like we were talking about on the Bristol stool scale? I'm going to pull that up for you. Hold on. But we like to use this chart because it helps us basically have people classify where their stool is. And
Yeah.
so I'm going to share my screen here so you can see.
I love this chart. I didn't know about it until my pelvic floor therapist, Angela, told me about it. And I was like, where has this been all my life? Because sometimes when you deliver pebbles, you're just like, I'm like, ah, I disappointed me in my gut today. I didn't perform.
Can, can you see it?
Yeah.
Okay, so we're looking at poop. So here, what we're really aiming for is somewhere between 3 and 4, but maybe even 5. And, I tell people type 1 and probably type 2, you need more water in that. Okay, so if you add a lot of fiber to type 1 and type 2, you're just stuffing hay in a pipe. Okay, there's already so much hardness there. And so sometimes people think like, oh, they're so constipated, right? They're
Yeah.
constipated and they're having a type 2 stool here, even a type 1, and everyone's like fiber, 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 fiber. But those stools actually are very fibrous and they need more water
Water.
normally. Versus something like type 5, looking down here, these sort of softer blob amorphous things, those probably need more fiber. I like to describe fiber as a bulking agent, right?
Mm,
So if you have fiber, it's going to pull everything together. It's going to mush it into the torpedo, number 4, right? It's going
mm,
to mush it and put it all into one thing. And here's like over fibered,
mm,
And so there's a balance: water, fiber, normalish. Now, if you're
mm.
looking at type 6 or 7, that's diarrhea, right? And I tell people diarrhea is not frequency. Diarrhea is the consistency. So if you go to the bathroom 3 times a day and you have a couple of type 4s, I'm not worried about it. But if you go to the bathroom 3, 4 times a day and every time it's type 7, that's a problem.
Did you
So
ever hear
it's,
that song, when you're sliding into home and your pants are full of foam diarrhea?
I have children. Of course
Sorry.
I've heard that song.
Yeah. Okay. So, like, does diarrhea? Let's talk about a healthy gut and then like an IBD gut. Does diarrhea signal something is wrong typically, or what's it signaling when I have it? Not me. Okay. Let's
Yes.
start with someone with non-IBD.
Yeah, I mean, I think in general, diarrhea usually signifies inflammation.
Hmm.
Now, that doesn't necessarily mean that. You can get diarrhea as a medication side effect, right?
Hmm.
You can get diarrhea because of hormone imbalance or enzyme problems. Something like thyroid hormone being off can cause diarrhea. Not enough pancreatic enzymes can cause diarrhea. But it's probably some form of driven by inflammation. But inflammation doesn't necessarily, you're talking about, it doesn't have to be IBD, which is inflammatory bowel disease. Inflammation can come from anything. You can get inflammation as a result of medications, blood flow problems, infections. All of these things can cause inflammation, and then you can get diarrhea.
So when like my family's from India, we're Punjabi Sikhs, and Delhi belly is something that happens frequently when we go back. So what happens exactly when and, in India, if you've ever been to the villages of Punjab, they don't really have toilets. Like you have to
Mm.
squat down and then you have diarrhea and you're sweating and you need water and then you're like, fuck, I gotta squat down. So
Yeah.
what happens when one
Which,
of
by
us
the
get
way, is good
gangrene?
for you.
Squatting.
Yes.
Say
But we
more
can get
about.
into that.
Okay, yeah, let's do Delhi Belly and then we'll go to
Table it.
squatting. Yeah,
I mean, usually, so like Delhi Belly and, people can get it from, what's the other one? Bali Belly. Um,
yeah.
it's
Montezuma's Revenge. That's a
Montezuma's
local.
Revenge, yeah.
Yeah.
These are almost all infectious. E.
Mm.
coli, Campylobacter, Salmonella, sometimes even Giardia, parasites. These are all usually from, many times from the water or the food. And it's a pathogen that you get that's infectious. Now, that infection causes inflammation, and then that causes the diarrhea. Now, that is, should be transient, unlike an inflammatory bowel disease, which is autoimmune, so it's your own body driving that, and that's
Yeah.
something that doesn't go away on its own.
Okay. And I don't mean to imply that you only get Delhi Belly when you visit Delhi. It's just
I think you're just
literally
saying
shit
you've
happens.
gotten it as somebody
I've
who's
gotten
been there.
Delhi Valley plenty of times because my immune system is very sensitive. So uh, the aim is let's go back to the chart and what our aim is. 1 to 3 times a day is normal. Yeah,
Not
there's
always, even every other day. Like you can skip a day, it's not terrible.
okay,
Some
and then
people have a bowel movement every other day, and that's normal for them. They have a good bowel movement, they don't feel bad in between, and then they have another good bowel movement 48 hours. That's fine, right? The other thing that I wanted to mention when we're talking about this is, if your normal is one type 3 bowel movement every 2 days, and then all of a sudden you're having type 5s 3 times a day, that's a change, right? That's an acute change. And what we say in GI is we're less worried about your everyday and more worried about the changes.
ah
Because when things change, that's when it's a problem. So change
okay.
in bowel habits is one of the most common non-screening indications for a colonoscopy.
Normal is a setter on a dryer, a setting on a dryer. That's what there's a book called that, and Becky
It's true, right?
told
Like
me
what's
that
normal?
what is normal. But uh and we talked a little bit, there's like this whole push about eat more fiber, eat more protein, like bulk like add 30 grams of protein. Can you t- can you help educate me on why there's this intense pressure on fiber, protein now?
Girl, I don't know about the protein. I can tell you, like, I saw a TikTok or a reel or something the other day, and it was this guy saying, like, I expected my whole life to have so much pressure to do drugs. Like they were like, putting it in my head, like, these are gonna come up to you. You have to be ready to resist. And it's like that pressure has only been seen in how much protein I need to intake. I don't know, honestly. Protein, I feel mixed about that, and I'm not sure that it has a huge effect on bowel movements. But fiber does, and like we talked about, fiber, like I said, it's a bulking agent. So you do want to make sure that you're getting enough fiber because fiber is going to put it into a nice log, bulk it into your torpedo. I like to tell people it's the Roomba of the colon. Like it's just bouncing around against all the walls, picking up all the crap, literally, and just slowly pushing it into a log and eventually expelling it. Now, that being said, if all you're doing is eating fiber constantly, I love the analogy of like it's like stuffing hay in a pipe, right? Like it's too dry in there. You can't bulk your stool at some point anymore. You have to have a balance, right? You need to have fiber, and then that's where water comes in. You need to have water. You need to make sure that you're moving around because you need to start increasing the squeeze of the colon. You need motility too. It needs to squeeze that stool out. So you want to make sure that you're getting enough activity.
Yeah.
But I would say there is a balance, and I've had to have the talk with many a patient about over fibering themselves.
Yeah, it's like the perfect cocktail. You need X ratio of water, X ratio of fiber.
Mm-hmm.
And it gets a little like, oh, like everything you see on TV or the ads is like Benefiber, bulk up. But it
Yeah.
differs from person to person. Like Sunday night, I had beautiful Moroccan food with my friend Ish, and I now have IBD, but those raisins did me in. Like I was like, ah, fuck, I ate too
Yeah.
many raisins
Right.
mixed with a glass of wine. I'm sorry, Dr. Bontala, I did have a glass of red wine, and I paid for it. Like I had a great torpedo, and then I had diarrhea, and I was like, oh yeah, I overdid it on. I think I overdid it on the grapes. Would that
Well,
be
yeah, I
accurate?
mean, that's funny that you mentioned Benefiber because I actually really love Benefiber as a supplement. And there is a difference between dietary fiber and soluble fiber
Yeah,
supplements.
let's talk
So,
about that.
yeah, so Benefiber is a soluble fiber supplement. So, let's say every morning you have your Starbucks and you mix a couple teaspoons of a soluble fiber powder in here. The goal of that, it's
Hmm.
just a sucker. Okay, so all it does is suck,
Yep.
but it does not increase colonic motility. So when you eat dietary fiber, raisins, celery, they are non digestible. And so the body is trying to digest the fiber, the colon is. And so it's doing this, it's trying to break it down and it can't. And so it's moving and moving. And while it does that, what's happening? It's making gas, right? So you're getting gas, bloating, increased colonic motility if there's a bunch of loose stool in there, diarrhea. And so I tell people, when you're introducing, if you're eating a predominantly low fiber diet and then you want to start introducing fiber into your diet, do it slowly because you're going to start farting up a storm and having fecal urgency if you go from eating zero celery to trying to consume, 16 celery stalks a day. You're going to be in for it.
Yeah, on New Year's Eve I did that uh I don't know, I was with my cousins, and my niece, my cousin and I all sat under a table and we popped 10 grapes in, and then or is it 12 grapes, and then before that I had had a Taco Bell bean burrito cuz I was just craving a burrito cuz I was flaring, and then, the next day I was like diarrhea cuz I probably pumped up too much fiber in me is what I'm
Right.
thinking, and it took me like 48 hours to recover. Can you back up and tell me what the difference between soluble and insoluble or dietary fiber versus a supplement? You said the Starbucks drink like a Benefiber. That means
Yeah,
my colon is working
like a
less.
fiber supplement is just like a powder that you can
Yeah,
mix into a drink versus dietaries like celery, for example.
yeah.
Um, but obviously, I'm not saying don't eat any dietary fiber. You want to do that, but just understand, like I'm just saying, like don't if you truly just getting it from dietary fiber and you're trying to increase your fiber, you may increase your colonic motility and get gas and bloating and sometimes diarrhea from that. So there's a balance and it's different for everybody.
That's a sexy word. Can you define it? Colonic motility.
It's just how much the colon's squeezing. It's a muscle. Your colon is a muscle. And so all the bowel is a muscle. Small bowel, large bowel, it's all smooth muscle, circular muscle. And, you know, when you get increased contractility of a muscle, it's doing work.
So, let's go to constipation and then let's go to squatting. What's happening in constipation with my muscles and etc.?
Um, well, constipation's not just a motor thing. So I think what you're asking is like, is squatting, why is squatting better, to have a bowel movement and things like that. And, the pelvic floor is made up of, I think it's like 27 muscles. I don't know. Maybe I'm wrong, but it's something like that
Yeah,
number.
Angela, my pelvic floor therapist, is going to come and talk to us a very
Oh,
long
good. She's probably
conversation.
going to
Yeah.
correct me, but
Yeah.
it's something like that number. And it requires a lot of coordination to have a bowel movement. There's shortening of certain muscles and straightening of other
Yeah.
muscles, and then a relaxation of a motor complex, and then the initiation of another motor complex. There's a lot going on there. But, if you think about the angle of the rectum, so when you sit, if you squat, your rectum is angled directly down,
Yep.
right? Into the ground or into the toilet, whatever. But in America, we like to have a bowel movement like this.
Mm.
So the pelvis tilts and it doesn't allow for a natural angle. And so I tell people, you want to bring, if you're struggling with exit of the bowel, so the movement is struggling to exit, you feel it there, right? You feel the rectal
Yep.
pressure, but the exit is the issue. Then you really want to experiment with changing the angle of stooling. And the best ways to do that are elevating the legs. So either, there's these things called squatty potties.
Squatty potty in the
Mm-hmm.
house.
Yes, we have a squatty potty in my house, but it's basically a stool that you put under the toilet. And instead of putting your feet on the ground, you put your feet on the squatty potty and it shifts your pelvis,
Yeah.
right? And that allows for a more natural angle of exit. And so I advocate, for squatty potties or even just a stool, or back in the day when we had phone books, you could put your feet on phone books.
Sometimes what I'll do is if I'm visiting, because by the grace of God, it took me a long time to figure out. I was working at a client site and they had a bidet,
Mm-hmm.
and I was
Big
like,
fan.
big, big fan. If anyone ever gets diagnosed with an IBD, like I wish we could just have Toto give us patients a scholarship and like, here, welcome, like a welcome package. Like you have an IBD. Here's your welcome package, a Toto or something to help. So what I do at any toilet, random, sorry, factoid about Totos, I'm just really in love with them. I'll take, if I'm at someone's house and I need that squatting, like mimicking how we do it in India, I'll take like the trash can,
Mm-hmm.
what's already in it and prop my feet up because it just, like, I can't take my squatty potty on the go. I wish I could, but I can't.
Maybe we should market that like a inflatable squatty potty.
Yeah, that'd be such a cool idea because sometimes yeah, you just need help. And Dr. Ha used to tell me about like when you travel, your bowel movement gets all
Uh,
off. Like what go like you get constipated or
Most
is
people
it
get constipated. I think a lot of it is the lack of water, the lack of activity, the lack
mm,
of fiber. All none of those three things are normal when you're traveling. Plus, you have the whole, anxiety thing weighing in, right? You're anxious about traveling, you're not going to make the flight, is the flight gonna, and if you have any underlying GI issues, are there going to be, is the bathroom going to be open? How big is it going to be? And that starts, I think we're probably going to have a whole episode or 100 episodes on the brain gut connection.
yeah,
But, you know, obviously the brain rules the gut. And if you start feeling anxious about these things,
yeah, yeah. I mean
then,
as an
it
IB
sends these messages to your colon and it responds
yeah,
a certain way.
as an IBD patient, I have to always think about where I'm going to the bathroom. Is there enough toilet paper? What happens if my butt need I think we joked about this. My butt needs a facial sometimes, so like this the Toto does that because you get a chapped butt. Like I don't know,
Mm-hmm.
is it the anus gets like
Mm-hmm.
really angry and red, and then the hot water from the Toto just helps. Or during the acute time of my disease, I'd go and immediately take a shower and just have one of those handheld and just kind of
There's
calm.
also, there's something called a sitz bath, which is you can actually buy a kit for a sitz bath, but I tell people and put it in the toilet, but I tell people all it really is just filling like your shower or your tub or a big bowl with warm water and
Yeah,
squatting in that for at
Yeah.
least 10 minutes because what warm water does is one, it makes it feel better, but two, warmth actually increases vascular flow to the area where it's being warmed.
Mm.
So if you make your butt warm,
Mm.
more blood vessels start shunting blood
Mm.
to your butt.
Oh,
And
that's
so
why, yeah, sitting even on a heating pad would feel good.
yeah, and then like if let's say you have to heal something, right? So you have a crack or a fissure or something that you need to heal in the perianal region. I mean, fissures is a whole nother topic. I feel like I'm coming up with like how
I
many
know. I
episodes?
thank God
So
for thank God for Kaylee to help us like keep track of our brains. Um,
anyway, like let's say you have a crack that you need to, so you're going to need healing compounds, right? And those all come from the bloodstream. And so if you increase the blood supply to an area that is lacking, that needs to be healed,
yeah,
you're going to
yeah.
increase all those healing compounds going there and speed up recovery.
Yeah, my challenge with the sitz bath was it was like sitting in a tub was fine, but then my vagina wasn't always happy. So the Toto and the heating pads were good, but do what you gotta do, dude. That's it. Like when we get chapped butts, you gotta do what we gotta do. Angela's told me that when I'm constipated, because she does a couple of things, and I have to say it took me a very long time to even know that a pelvic floor therapist existed. My gynecologist told me by accident, and I'm like, where have you been my whole life? So I do want to acknowledge because I'm in Southern California and I am a nerd, I'm a very pain in the ass patient because I ask a lot of questions and I advocate for the rest of us. I'm very blessed to have found a pelvic floor therapist, and she told me sometimes when you're constipated, you can actually also massage your
Mm-hmm.
gut. Like that
Mm-hmm.
helps things move. She told me to get up and move and take like a walk. And then I think you taught me, like, thanks to what you told me during one of my flares, you said, like, eat coconut oil, which I've been
Mm-hmm.
doing. So can you tell us, like, what else we can do when we get
Yeah, I mean,
backed up?
I know there are certain foods that can help.
Mm,
The old traditional is something like prunes, right?
yeah,
And those mostly help because they increase colonic motility. They're like raisins, right? So even though they're increasing the squeeze, they're not necessarily making the stool softer to evacuate. So
mm,
I tell people like if you have a lot of hard stool, like back to the pictures like 1 and 2, and pain, I would stay away from things like prunes because they're just going to worsen the pain that you're having. What you want to do is add something that has some laxative function to it. So something like coconut oil is very
yeah.
beneficial there. I was just talking to a patient about it today. Um, Also, I really love kiwis. Kiwis are kind of like this magical fruit. They have a lot of different compounds in them, maybe some magnesium derivative. I'm not sure we know everything that's in them, but they definitely are laxative inducing or laxative like medications. I mean, fruits. The other one is passion fruit. I mean, dragon fruit.
Really?
Dragon
Dragon
fruit.
fruit,
hmm
pitaya.
So,
Yeah.
dragon fruit is a big one. So, that's really helpful. And they grow, rampant down here in Florida. So, we're lucky. We're all pooping. But those tend to be really, those are the ones I really recommend. And then I also tell everyone, you know, if you're struggling with chronic constipation and you're looking for supplements, one of the first things I recommend for everyone is magnesium, specifically magnesium citrate pills at night. I think magnesium is underutilized, but it helps so much with the GI tract.
I think when I was I don't know, during one of my flares, they told me like ease like don't take the magnesium
Yeah,
citrate
don't
because
take
I was
magnesium when
having
you're having diarrhea.
yeah, okay,
We're
so
talking about constipation.
yeah, okay, just want to clarify because there's so many magnesiums now. There's magnesium to help
hmm
you sleep, there's magnesium for your gut. So what the one we should be looking for is magnesium
Citrate.
citrate. Okay. Thank you for
Hmm.
clarifying that.
That being said,
Um,
like I take magnesium citrate, full disclosure, and I think it helps with sleep. So even though there is some crossover, like some of my patients take magnesium glycinate and they think it helps with their bowels too. So even though it's like magnesium, citrate is for this and magnesium glycinate is for that, magnesium sulfate is for this, I think there's probably some crossover, right? Because
okay.
there's magnesium in everything. So if you really need magnesium for neurologic headaches or something like that, you know, you try the different ones out and see which ones help you more.
Yeah, I always have to check with my registered dietitian because, like, as an IBD patient, you just have to be mindful that certain things can cause too much stuff to happen. Another thing I wanted to ask you, I mean, hey man, if I'm gonna ask anyone, it's you. So when you do get these like stings in your rear end or biting, like the besides the sitz bath, I think Dr. Ha used to tell me to put like diaper cream or what can
Hmm.
you do? Vaseline, can you help? Is it literally like a chapstick for your butt? What is it?
Yeah, so this is a good question, and so there's sort of two things you're getting at here. So one is the true anal fissure, which is a tear around the anal canal. I tell people it's a cut, right? And
Yeah.
it's a cut in an area that literal bacteria filled stool has to go through and has to dilate whenever you're having a bowel movement. So that is extremely hard to heal, okay?
Yep.
But let me tell you, fissures are much more common in this country than they are anywhere, any other country. And that's a combination of our diet, our lack of exercise, the angle of which we poop, sitting on the toilet the wrong way, how long we sit and poop for, our hard stools, and then the worst offender of all, which we haven't even talked about, which is, drumroll please, I hope they never want to sponsor us, but toilet paper.
Oh yeah.
Shout out to Charmin, love you, but seriously, you're ruining us because
Yeah.
Americans love to wipe. We are obsessed with wiping, and the wiping over and over and over until it's clean, clean, clean. That is the worst thing you can do for a fissure. So if you do develop a fissure, I tell people the first thing is chucking the toilet paper. Just you've got to get rid of it. And the problem when you do develop a fissure is that they get itchy
Yes.
and then you want to wipe because they're itching and I'm like don't do it. Don't wipe. So I think obviously a bidet is number one there. But if you can't afford a bidet or you're in a place where you don't have access to a bidet, I tell people my recommendation is going to like a Dollar General and getting a 10 pack of washcloths, getting a
Mm,
few of them, and just warm water on the washcloth, dab, throw it away when you're done. You can
yeah.
use a water wipe, but no wipes that have any medicated anything in them.
And
Um,
don't flush.
and
Don't
don't
flush
flush
those
those,
away.
bad for the environment.
Yeah.
So, and then sitz baths, and then
Yeah.
after the sitz baths, that's when the coating starts.
Pat dry, and
Pat
then
dry, and then you put on the thick layer of, I like zinc oxide paste because it's very thick. And what you're trying to do is protect that cut from getting sweat and garbage inside of it so that nothing gets in there and you promote the healing. However, I'm saying all this stuff, right? I'm going to
mm,
tell people to do this 4 times a day. That is a huge time commitment.
mm,
It is a crazy, which I understand, but you have to commit
mm.
to paying all the attention to your butt because if you quote unquote half-ass it, it takes so much longer to heal.
Yeah. Sometimes I have a rough day, and Dr. Ha would say, put on the diaper cream. Um, I don't know what you call it, but it's got like a little baby on it. And
Boudreaux's butt paste.
yeah, I
Yeah,
put
that's
on,
zinc oxide. It's my
yeah,
favorite.
yeah. So I put on the diaper cream, and you know, in the homeland, it's really amazing how my homeland had my people had it, right? Because over there, you squat in a hole. I mean, India's modernized significantly, but you clean yourself with water. You never clean, toilet paper, all that stuff is bad for the environment. But my friend Ish has something that can attach to your toilet for everyone. You know, not there's barriers of entry for a bidet from an economic standpoint, but she has something that attaches to your toilet that's like a spigot,
Yeah.
because and it's actually quite affordable. I'll have to ask her so we can share it with our listeners, but I found water to be more healing
Oh,
than
definitely.
the toilet paper because it just makes my butt pissed.
Yeah, even
And
just
it's
going
not
in the
fun.
shower afterwards,
Yeah,
that's fine too.
yeah. Yeah. I'm trying to think, is there anything else that I wanted to talk about today with you and I together? By the way, Dr. Soyka, I gotta show you my water bottle. It's got a picture of, can you see it? It's got a picture of Dolly Parton and it says, "What would Dolly do?" Because, you
I
know,
love Dolly Parton.
I think who doesn't love Dolly Parton? I gotta go to Dollywood. I think that's on my
Should
bucket
we like
list.
make a thing like if you don't like Dolly Parton, you can't listen to this podcast?
No, but I am brown now, so maybe someone needs to accompany me to that part of the world.
I love Dolly Parton, and I also really want to go to Dollywood. I'm a huge Disney person, you know that.
Yes.
And I'm obsessed with Disney and actually just kind of theme parks in general. Um, I'm like a weird theme park person. Like I also really love
You're my type of
Universal and
weird.
SeaWorld. I love SeaWorld. Not necessarily the animals, although I do like the animals, but I love their roller coasters. I'm like a carny at heart. Like I love fair food. I love like the lemonade. I could just go on.
A
But
carny
anyway,
at heart. I've never heard that. I
like
like going to like
yeah,
a carnival junkie.
yeah, like a maybe I should have like been in the carnival. Like
I
what would I be?
that's a I
I
don't
don't
know.
know.
That's
I don't
something
have
I'm
many
learning about.
carnival talents. Maybe I would just like sell the tickets or something.
Yeah, I think I just went to Disneyland with my nephews and my sister. And my sister and I were like, this is a great place to retire. Like, you know, like work behind the scenes. I do not like going to theme parks without someone who's type A organized because now you have to like plan which ride you're gonna go on. And it's
Mm.
very, like, I find it very stressful. But I do want to hit Dollywood and I do want to go to the pandas are here, right? And there's no tariff on them yet. So I wanted to go to San Diego and go. I'm like resonating with pandas, which is a whole nother article I'm working on right now as my spirit animals because they just are very chill, but they're still bears. Like don't F with them. But I do want to go to San Diego. But you and I have a date to go to Dollywood. You will be my date for Dollywood if you
I know
don't mind.
we have to do it because I really want to go.
Yeah, I know. And you know, we want to pay our respects to the Queen, Dolly Parton. We do love her.
Pandas are pretty smart, but did you know my son showed me the other day this YouTube video that koalas are like the dumbest animals. Apparently their brain is just like gelatin and it has like nothing to it. And the reason that they just sleep all the time is because the eucalyptus that they eat is actually poisonous to them and causes them, it has like some toxic compound in it that like I don't know, gets them
Numbs
high,
them.
makes them sleep. And so then they just like eat the eucalyptus, get high, sleep, wake up, do the same thing. And the reason they has like unlimited eucalyptus because like no other animal is dumb enough to eat it. It's like an
Yeah.
unlimited supply because like it poisons them all. But the koalas with their jelly brains are like, let's go. So, and then like they're not really prey to anybody because they're just like dumb.
No, I'm having a moment with panda. I even have one sitting here to remind me of my panda spirit, but that's a whole nother session. So, I think we're at time, unless there's anything else you wanna um like partake.
No,
Um,
I think that was good. I mean, what I really hope is that our listeners get something out of this. I really hope that this opens up lines of discussion for people either on our social media channels, on our website, under this podcast. Comment, let us know what you think. We're happy to weigh in on your questions and your comments, but I also really hope that it opens up lines of communication in your own life, right? Like talk about it with your friends, your significant others, your parents. We have a social responsibility to make sure we're all okay, And
yeah,
and I hope that you feel empowered to ask questions and make sure that everybody's okay.
yeah, I like that. I like the word you ended with, which is hope for empowerment, hope for conversation. And Dr. Soyka and the Scrubs and Heels crew has heard me say this, and some of my friends. I read it on Instagram. I'm not sure where I read it, but if cauliflower can be a pizza crust, anything is possible. So we'll end with that. And until we meet again, mwah, bye.
Thank you, everyone.